Well, hello, everybody. This is Irina Strunina, and this is our podcast, Diabetically Speaking with Smart Move 360. We go live every Thursday at 4 p.m. Eastern Time, and I am inviting here experts, people who work with in the medical industry, people who work in social environment, people who are helping in one way or another those who have been diagnosed with type 2 diabetes. So every time I'm trying to bring someone who can tell us something new, something that we didn't know maybe. And especially now, it's a month of November, Diabetes Awareness Month. 14th of November is the Worldwide Diabetes Awareness Day. And I learned today why. Apparently, on November 14th, is the birthday of one of the inventors of insulin. Not inventors, but this is a silly story. Apparently, World Nobel Prize was given to people for the insulin 3 times. Believe it or not, somebody discovers something and it's given once. For the insulin, it was given 3 times. So one of those recipients had his birthday on November 14th, and that is why today is Diabetes Awareness Day worldwide. So, with that, today I have a very special guest. We met through mutual friends, and I was so happy to meet with KatieHall now because we are right now in this period in the year when we need to know as much as it possible about different options, how we can sign up for what insurance we need to have, what coverage, medical coverage we should have. All this is very important information. This is already the second podcast when we are discussing this, discussing different alternative ways to arrange medical care for yourself and your family. So first, I wanted to welcome Katie and ask you to introduce yourself. Just what are you doing? Where are you coming from? And then we will go deeper into what this I'm talking about this alternative medical coverage. So welcome to the show.
Well, thank you first of all, thank you so much. I just want to give it back to you just for having me on and what a privilege it is to be able to meet with you. Again, our first conversation I thought was fabulous. And just what you're doing here to helping those who are struggling with diabetes and doing what you do to try to help them and give them incredible information. So thank you so much there. I just want to give you that back. But
Thank you.
yes, everybody, my name is KatieHall. I happen to live in Southern California, and I happen to be a native of Southern California, and I love living here. My roots go deep. My mother was born here. My dad was born in Kansas. But anyway, enough of that. But so how I got to this particular place where I am now. So right before what I was doing is I'm offering healthcare right now. I was actually in the health and wellness arena where I did a little bit more of nutrition, and I also did some skincare. And I love what I did. And I just felt like I needed to pivot with everything that was going on in the economy. But then when I was praying about that and wondering what I should do, I was introduced to this company. And when I was introduced to this company, I thought, this is the perfect fit for me. I love helping people. I love educating people. So that's how I started to be here. So I'm married. I have a husband. I have 2 sons. I have 2 grandsons. And life is full. We're expanding. And I'm just grateful to be able to be here to share this with you. I happen to offer impact health sharing, and it's an alternative to the traditional way of getting covered medically for your health care. So that's the beginning part right there.
Well, thank you for this introduction. I learned something about you today, what I didn't know about your family. And but what I wanted to just move on this. So it's alternative healthcare system you're talking about. Compare, not compare, but alternative to the traditional medical insurance. So can you please tell us a little bit more about it? Because it's very hard to guess from the name.
Yes, yes. No, thank you for asking to get a little bit more information. Yes. So, health sharing has actually been around for over 40 years. I know a lot of people still don't know about it. The company that I'm with has been around for 5, going on 6 years. But traditionally, insurance is, and most of you know, over the last several years, the cost is almost becoming prohibited to be able to afford, especially if you are self-employed and or let's say you're paying out of pocket for yourself versus getting it from an employer, which God bless the employers that are still paying for that. So when I talk about health sharing and the company that I'm with, it really truly does look like, it feels like, and acts like traditional health insurance, but it's health sharing, where we share each other's medical bills and we call ourselves members. So, and we're focused a lot on being healthy, which I love, our healthy community. So, what makes us different is we don't have a network of doctors. Most traditional health insurances do. And a lot of health sharing companies do too. But with us, there is no network of doctors, meaning you get to pick whoever you want to go to. It is comprehensive medical care. It is accident, injury, as well as wellness care and everything. It does include surgeries if you need surgeries, etc. We also include, let's say, RX pricing. If you need a prescription, we're hoping, of course, as most of us, we don't want to have to take medications, but if you do need the medication, we definitely have that. I would say if you compared us, some of you will know who GoodRx is. I would say 90% of the time our prescriptions are less than GoodRx. We have starting individual rates starting at $73. Of course, those are for the youngins, meaning like 18 to 25. We have never raised our prices, which I'm really great. But the difference of price for an 18-year-old compared to a 58-year-old, well, there will be a difference. It'll cost more to do that. You're very used to the term deductibles.
Yes.
And usually with deductibles, with traditional insurance, it's per person. So ours is actually a household. So if you have 3, 4, 5, 6 people in your household, it's for everyone. And we have what we call a primary responsibility, which is like a deductible. We have it as low as $2,500. Of course, if you're a single person, you're $2,500 or higher. You can pick different deductible amounts or primary responsibilities. And one thing that makes us different than I think from traditional health insurance is we are actually offering our members up to $100 credit every month when they're doing things to help them just to stay healthy. So do you have a gym membership? Do you take any supplements? Do you see a naturopathic doctor, acupuncture, cryotherapy? You name it, it's the whole gamut. Massage. You can lower your deductible or your primary responsibility up to $100 every single month as our thank you for staying healthy. We also include a dental and a vision discount card. So that's pretty new. We love that. And we're not for profit. So our model is a little bit different than traditional health insurance. Some of them are for profit, not all, but most of them are for profit. So we're nonprofit. So all of the funds are going back to the members. Yes, we have a CEO and other folks that work there. And yes, they get paid. We just get paid on a fair market value. So I love that about us. And I hope that gives you a little bit of comparison. I don't want to put down traditional health insurance, but you have an alternative, and typically you save 30 to 50%. I guess that's a big deal to a lot of people.
Definitely. So, all right, now I have questions. And to begin with, so you said you don't have network of doctors, so how does it work? How do we know if any doctor can accept payment from your company?
That's a great question. Yes. So when you become an Impact member, you are going to have access to a member portal, and
Uh-huh.
you can put in a way like an internal email, and it will go to Impact, and you let them know like let's say your first appointment, you want to go for a wellness check.
Yes.
You can put that in and say when your appointment is. So let's say I become a member on December 1st, and my appointment's on the 15th. I will let Impact know as soon as I become a member on the 1st, say, hey, I've got an appointment with Dr. XYZ, and they'll connect with that doctor and let you know about that they have a patient that wants to come and use the Impact medical card. Also, on the member portal, we don't have a list of doctors that you have to use, but there is a list of doctors that are called preferred providers
Okay.
that already know about Impact. So you can also select from those doctors as well.
So you're saying that if, for example, I would like to become your member, but I still would like to keep my provider. I like my doctors. So I am informing your company that I am working with these providers, and you go and educate them or educate their office about your company, and they just accept this relationship, so they have a choice to pick or agree or not agree. Is it?
Well, another great question. Yes, of course they have they can agree or not agree. So let's just go, we'll start off with worst case scenario. Worst case scenario, you want to go to this doctor, that's the only one you want to go to, and that doctor says, absolutely not, I want nothing to do with this. You can still go to your doctor and you can pay, and then you get the super bill, because what's great about Impact from different health sharing companies is we actually use the medical codes. So you'll pay, and however they decide to charge you, that's worst case scenario, usually a cash pay, something like that. You're going to submit it to Impact. Instead of Impact paying the doctor, Impact's going to reimburse you.
Oh,
So that's worst case scenario. But yes, otherwise, Impact's going to be educating the doctor. When the doctor finds out how well we pay, so most of the time when the doctors make an agreement with an insurance company, I won't name any, you can think some in your mind, they're actually signing an agreement with that particular company of how much they're going to get for an office visit, an EKG, a particular procedure. They've already said, this is how much I'm going to get. So for an office visit, they might charge $250, but the insurance company only pays 65 or 75. Okay, so Impact typically, when they make an agreement with the doctor, we don't just pay the 75. We typically will pay, and I'm not exactly sure how to do the math on this. If that would be 100%, we would pay 120 or 140%. So we treat the doctors well, but we do reprice it. So you're not going to be paying the 250, like I said, like the cash pay. We do what's called reference repricing for the member. So that's another great fit. I hope that helped, like knowing the worst case scenario. But most of the time, when the doctors find out how much we pay and how fast we pay, our goal is to pay the doctors or the hospital, the facilities, in 30 days. And last time I checked, we paid on average in 16 days. So yes, some got paid faster, some took a little longer because they were negotiating. But Impact negotiates the price on the member's behalf.
So you becoming like members' representatives in their relationships, in their communication with the doctor offices.
Are you talking about me personally, or
Not you personally, the company. I understand that everybody has their own responsibilities or circle of activities, but you're saying that every member who signs up with your company automatically receives a representative who will be talking with the medical officers about the payments arrangements and stuff like that. Is it
Yeah,
correct?
they have a department that does that.
Uh-huh.
Of course, I'll get involved if somebody says like, "Hey, I'm not being able to get through," or that's never been the case for me. But call me up, or I'll walk you through how to get a hold of Impact because now we're going to be talking about HIPAA laws. Although I am life and health licensed, and I could probably talk about those things. When you start talking about medical things, that becomes HIPAA laws if it's very
Yes.
specific. If it's something general, I'll show you how to like, oh, Katie, I'm not sure how to get my $100 credit a month. Oh, okay. Well, here, go here or watch this video because we have all kinds of videos that train and
Mm-hmm.
everything. Of course, I'll help. But they're going to have access directly to the company.
Okay. So, but what if, God forbids, emergency situation and somebody is calling 911 and being, drive to, and they have to go to emergency room. What happens then?
Yes, thank you for asking. Every single hospital can never deny anyone.
Yes.
Okay. And so when you go there, you'll have your card or somebody that, if God forbid, if you're unconscious, somebody will know that you have impact health sharing somehow, some way, and be able to get that information. There is a number on the back of the card. It just looks like a regular medical card, and they'll have a number that they can call and they can find out, say, we don't know what this is, right? Because
Mm-hmm.
it's relatively new. And it's weird because health sharing has been around for 40 years, but not everybody knows about it. And they're not clear on the fact that we are actually different. I think why some people maybe in the past might have been slightly hesitant is because the old school way is everybody just submitted everything like paper. It's like snail mail, right? We are based upon electronic platform and it goes very quickly.
Okay.
So, but yes, the hospitals will accept you. Yes, there's medical treatment for everyone. And yes, Impact will handle it.
Okay. All right. Well, I do remember that sometimes people happen to be in the hospital without any information, medical information, insurance information, ID, but then relatives, friends gather this together, and then financial person will come to the room to talk about the financial responsibilities. All right. So you said that in your company, you do actually encourage people to work with the non-traditional medicine, like people who, not people, but say chiropractors, people who provide this not Western medicine style care. Is it correct?
Yes, absolutely, 100%. We do not dictate who you should go see, or we do not dictate how the doctor will provide treatment for you. So a lot of things that makes us different with impact health sharing versus traditional insurance is what I found out is that there is like a list of protocols. Like they're going to say you have to do this, and then the next step is this, the next step is this, the next step is this, before you get to what you really wanted. Like, hey,
Uh-huh.
could you really just, not that everybody wants an MRI, but can I just get the MRI?
Mm-hmm.
But with impact, if your doctor thinks right from the get-go, if you need an MRI, yes, it's one of those items that you have to call ahead, but they get approved. Okay.
Mm-hmm.
But they're not going to, Impact's not going to tell you, hey, you have to do steps 1, 2, 3, 4 first. We don't get in the, we're not in the business of telling you and your doctor your relationship on how that should work.
Mm-hmm.
You get to dictate, you have a little bit more control.
Okay. So we now know about the traditional way, all of us being under this care uh, for some period of time, most of the time. Then
Mhm.
we also learned lately that this concierge medicine rising and becoming more popular, and I know several doctors that actually moved to concierge medicine, and that's what they're doing now. But what I've heard, I don't know, that it's quite pricey, that this is, you get the perfect care, you get full attention, but you have to pay a price for it, for this service that is really focused on a patient. Then we've heard about other alternative membership-based options that similar to it, but really around the office, where doctor is meeting with the patient and doing everything that this office has to offer if you need it. I'm talking about the blood work, I'm talking about different therapy, about treating different diagnoses. But if it comes to surgeries, some hospital involved, then they have also a network who is working with them. It's different, and it's fraction of what the traditional insurance in cost-wise what it costs. So where will you put your company and which level between traditional and concierge? How how does it fit?
So let me see if I'm understanding what you're asking me to do. So
Yes,
are you talking about like a direct primary care physician where you pay a membership and you have access to that
yes,
physician and they
yes.
do pretty much everything but surgeries, right? Okay. As a matter of fact, I just met a gal who does that. This week we had a conversation and she reached out to me because she saw me on an online post and she goes, I'm looking for something. A lot of my patients already have a type of health share company that they work with, but I like yours because it's based upon this electronic platform and the billing is easier and things like that. So if you, let's say you had Impact and you also wanted to use a direct primary care physician, this gal, I know they're all different. She happens to charge $100 a month for adults, $50 for kids.
Yes,
So if it's two members, two adults, two kids, that's $300 a month, right?
yes, for
I believe with
family.
this, it depends upon what they, if they had traditional health insurance before or not. Um, they could take of that, let's say $350, they could take $100 of it and lower their deductible every month because that would be considered part of the health and wholeness credit.
So you're suggesting that these two can be combined?
Yeah, absolutely, 100%. So she was looking for something or someone to work with and refer back and forth to. So when her patients did need, let's say there was an emergency, hospitalization or a surgery that's needed, etc. She's, of course, let's say, encouraging them to maybe take a higher deductible. Of course, they're going to make their decision because then if you have a higher deductible or a primary responsibility, your payment's lower. Very similar to like car insurance. High
Yes,
deductible, low payment, lower deductible, higher payment.
yes,
So if you got a higher deductible or in our case, the primary responsibility, then I kind of call it more like emergency or hospital insurance
yes,
or
yes.
care. But it's healthcare because I'm not insurance. I am actually health sharing.
Uh-huh,
Does
uh-huh.
that help a little bit? Like where do I fall in there? I think it could be a marriage in a sense. Um, I think I know about the direct primary care that you're talking about, and then I'm not sure about the other one if I know everything about it. So I think there could be a marriage in there where it covers surgeries. I do know that when you work with Impact Health Sharing, so here's the thing too, because I know that the direct primary care doctors, they get a very good discount on blood work and things like that.
Yes.
And so do we. Okay. So they could use that. And you get one of those, you get up to a certain amount of dollars every year that would go towards you. And that doesn't cost you anything. That's part of your membership. Um, as, as we're, working together, Impact Health Sharing, when you go, let's say you have a hospital emergency,
Yes.
and you have to go to, or just to the doctor for something. Okay, on average, Impact, remember how I was talking before that they're going to negotiate on your behalf? It's called reference repricing.
Mm-hmm.
So Impact on your behalf, and on average, when you get a medical bill, will reduce it on average about 72%. So
Mm-hmm.
you're going to get a pretty good savings.
Wow.
Now, what do you do if the doctor says, absolutely not, I'm never going to work with Impact? Impact will never let a member go into medical debt. They will pay that for you, and then they'll negotiate and give you the price that it would have been at the reference reprice. That's what I'm understanding, but we can fact check that with Impact. But that was my understanding that I did hear from the CEO's mouth that he will never let a member go into medical debt. They will pay those bills. We'll have to find out for sure about how all that money works. But I did hear him say you will not go into medical debt.
Okay. All right. Now I have a very important question. When someone had coverage, insurance coverage at their work, and for whatever reason, they left that work, and say it happened in April or maybe in July. So they, for the rest of the year, they need to make a decision. They either go under what it is, umbrella, how somehow this is a very expensive
Cobra. There's Cobra.
Cobra, or they stay uninsured because it's not the enrollment season yet. How about impact? Can people sign up anytime, any month, or they still have to wait till November, December to sign up?
Okay, great question. So even with traditional health insurance, if there is what my understanding is if that you were to leave the job, if there is some type of a family event that's changed, then contact your medical provider or the insurance person that you're working with. There might be a way to get insurance. Maybe it's only Cobra, but I thought if there was an emergency, you could still get it, but it would still cost you because now it's 100% out of pocket for you.
Yes.
Now, the great thing about Impact, that even though everybody's thinking right now, November, December, and part of January, it's open enrollment season, you can actually enroll with Impact every single month.
Okay.
So as long as you sign up before the last day, let's just use November as an example. If you sign up November 30th or before, and for me, it's just so anybody's watching this, it's before 2 p.m. Pacific time. December 1st, you will have coverage. You will be enrolled as a member. And another beautiful part, what you're just talking about, if that same person that you were talking about would have been an Impact member and they needed to leave because they were moving or leave because the company was downsizing, they are the owner of their Impact membership and they can take it with them and it never stops.
Okay.
Now, if the employer paid part of it, because some employers are paying all, part, or none, they're just offering it as a service. But let's say the employer paid half and it was a $300 a month fee and they paid $150 and you paid $150, then the member, of course, would have to take up the slack of what the employer was paying, his $150 or her $150 and their $150 to make the $300 payment. But they own it. It's portable.
Okay. All right. This is a good information to know because I had, not me, myself personally, but my friends had these situations when, for different reasons, they got out of, they lost the job or the company went out of business or company moved to different state and they didn't move with the company. So they lost the coverage and they had to use this Cobra situation when it was a whole lot of money to pay for insurance, but because they had kids, because they had their health was not in the best place, they had to just swallow this bitter pill.
Yeah, it's a huge pill. It's not uncommon for it to be 2 or 3 times what they're used to paying. And I don't know why it's that expensive. I really don't.
Definitely. Well, Katie, I know there is a lot of questions that I can continue ask you, but we are at the end of our show, so we need to wrap up. So first of all, I wanted to thank you for being available and meeting with me and talking about it because I believe that everyone has the right to know what is out there. We are so uh, focused on getting medical insurance on in a traditional way that we don't even consider to look around. And like we know this is what it is, and this is expensive, and it's getting more expensive with age and inflation and everything, and that's what we have to do. But as I said, there are different options available, and one of these options that you today told us about is a great way to consider to know about, and at least for this period of time between the jobs, people could have this membership, right?
Absolutely. 100%.
Yes, thank you. Now, how people can get in touch with you if they have more questions, if they have, if they want to sign up. Are you in every state, or it's just California, or how it works?
I actually, it's offered in 47 states. So I'll just tell
Mm-hmm.
you the three at the moment that you can use this, by the way, in every single state in the United States. There's just a couple of states that just have some old laws on the book that regarding health sharing. So right now in the state of New Jersey, Rhode Island, and the state of Washington, you're not allowed to purchase it, but you can use it. And by the way, you can actually use Impact internationally if you travel. Now, you cannot plan a surgery out of the
Yes.
country. You have to have it here. The surgeries have to be planned here. But if you were traveling in Europe and you slipped, you fell, maybe broke a foot, yes, Impact would pay those bills as well.
Oh, wow. That's a great information to also to know. So how people can get in touch with you, how they can find you. I need, please, after the show, please give me your contact information and we will post it in the comments under the our video so people will be able to get in touch with you to ask questions or sign up, whatever it will be.
Yes, thank you. And by the way, I'm big on education
Yes.
because I know that this is a little bit different. It's kind of like when we took our first Uber, we said, "You want me to do what? Get in whose car?" Or when
Uh-huh.
we stayed at Airbnb, I'm like, "You want me to get in somebody's car that I don't know?" Although we don't really know taxi drivers either, and stay at someone's house. But now we don't even think about doing an Uber or an Airbnb. So
Yes.
I guess depending upon your preference.
Okay.
But
Yes.
yes, I'm happy to do that. And my website, you can reach me at Katie
Mm-hmm.
at secureyourhive.biz. So that's just the different, a little bit different on the end .biz. So Katie at secureyourhive.biz. There is a way to be able to leave some information there for me, but I will give you all the other information, and then I'll also include a phone number and they can text me to get a hold of me, and then I can get them. I can either educate them myself or we do an educational webinar every Tuesday at 9 a.m. Pacific time. And we have 100, sometimes up to 500 people
Oh,
on
wow.
an educational webinar because people are really wanting medical freedom.
Absolutely.
So,
Well, that's great information to know. We will post all this in comment section, so please, everybody, look at it, share it with your friends, share it with whoever you think may use it and may need it, and let's stay on top of it. We are in charge. We are making a decision, not somebody else. We are making a decision how to take care of our own health. Well, just a quick reminder for everybody that we already running out of time, but that's not the reminder. I wanted just to let people remember that every Tuesday on our Facebook group, we have nurses going live not in the video, but they are sitting in front of the computer and answering the questions in real time. So you look for Telenurse Tuesday banner and put your comment there at 7 p.m. Eastern Time. Our nurse will go there and will be answering your questions. Every other Wednesday, we have our support group meeting, and that is something where you can log in. It's a Zoom, it's not in Facebook, so it will be kind of guarded by our Zoom settings, and you could actually get support. You could get some questions answered. Very often we have our healthcare providers joining us, so don't miss that opportunity. Of course, every Thursday at 4 p.m. Eastern, we have our Diabetically Speaking with Smart Move 360 podcast, which also is available on YouTube. So if you would like rather listen it on YouTube, please grab the link, sign up, like and share, and it will be a great service for others that you could offer, providing information. This is a great thing. And one more thing, I wanted to remind everyone that on December 7th, we will have our next, last for this year, Diabetic Healthcare Expo, where we are going live and we are talking about all aspects of life with diabetes. So mark your calendar. It's Saturday. We go live at 10 a.m. We are staying through 4 p.m. and share it with others. Hopefully, we will be able to help you and your loved ones to learn more information that you're looking for. With that, we are wrapping up. Thank you very much again, Katie. Share with everybody, or especially those who need it. Come back to us, text to us, comment. We will be staying in touch and we'll be communicating with you.
Again, Irina, thank you so much for your time in doing this for your community.
Absolutely.
Thank you
Thank
for
you,
having
Katie.
me.